this afternoon. So thank you everybody for being here at the Research to Practice webinar series on health communications and injury and violence prevention. Today's webinar, we're going to explore strategies and best practices for health communications within the realm of injury and violence prevention. So this is to enhance our understanding of resources and their application in research dissemination, and really focusing on the ever-evolving world of digital media trends and the fascinating realm of AI technology. So I want to welcome our speaker today. She is a valued member in the injury prevention communications community. Tracy Mehan is the Director of Research, Translation, and Communication at the Center for Injury Research and Policy at Nationwide Children's Hospital. She brings a wealth of knowledge and experience in health communications and has been really great at driving research dissemination efforts in the field at Nationwide Children's. So we have a lot to cover today, so please utilize the chat function if you have a question. Otherwise, we will have time at the end to discuss other questions. So thank you again for being here today. Without further ado, I will give the floor to Tracy.
Thank you, Noelle, and thanks for inviting me today and for that great introduction. As Noelle mentioned, I have a ton of stuff to cover, so I'm going to jump right in. First, I wanted to start with talking about why dissemination matters. And I'm going to have a couple examples here, but I wanted to start with COVID. It's not an injury topic, but the health communication around COVID had a lot of very visible communication fails. And I bet all of you can think of examples of that. And had we gotten the message right more quickly, things with the pandemic could have turned out very differently. So I think it is a really recent and vivid example of why communicating about your research matters and what can happen when it's not done in the best way. So that is one example. In terms of injury, just one topic example that you can do this for any topic, but I'm going to use firearm injuries, as one example. So we know that firearm injuries are now the leading cause of injury-related death for children and adolescents. And we see stories about shootings, both unintentional and intentional, in the news far too often these days. What happens, though, is people don't know where to go for valid information that they can trust. We have community groups, media professionals, school personnel, members of the public, all who are working in this space and want to know where they can find the latest research and numbers on what's happening in their area from people that they can trust. And they don't know where to turn always because we aren't speaking up loud enough or importantly, in the places where they go for information. So we're going to talk a little bit about that today. And you guys have some good examples there locally. And Betts, for example, is doing a great job of covering this. So if you're not familiar with her work, make sure you're checking out what she's doing and how she's doing it. There's lots more we can all learn. I also wanted to start with this slide. I like to say, if a tree falls in the forest, no one is around to hear it. Does it make a sound? We're all familiar with that, right? Similar thing with research. If we do research and publish it in a journal, but no one reads it, are we really having an impact? And that might be a little harsh, but we have to make sure our research is being talked about where the people who will impact are. And that's different places depending on what the audience is, but it may also be different places from where we as researchers are. So that's what we're going to talk about today. How do we maximize our impact of our research that we're doing and make sure it's really getting out there? So I like to start with this. This is old research, came out in 2009, but the concept is still valid. At the time this research was done, they did some analysis and looked at how long it was taking research to go from identification of a topic as a priority for research funding all the way through to when it's actually the findings from the research are happening in everyday life and in the public. And it, on average, took 17 years. 17 years, that's crazy. When I first started in the field, my son was just coming into elementary school, kindergarten, and he's now graduated from college. And there were things that happened when he was born that I didn't know about till he graduated from college because it was taking that long, right? We can do a better job. Social media has helped us with that, but there is still more that we can be doing to get our work out there and get it out more effectively. So this is just one, rough example of a research to practice model that includes communication as part of it. And so it can look like earned media, which is news that's covered on traditional resources. You can have collateral materials. This is all the stuff that we create, which can be the fact sheets and reports that we know about, but it can also be social media, videos, blog posts, podcasts. We're going to look at examples of all of those. It can also be education and outreach, which is a part of what we do. And even how we talk about our research can impact how effective that training and education and outreach is. It can be doing things like redesigning products and advocacy, and all of that can come together in how we talk about it and how effective we are in those spaces. Okay, so I'm going to start with some examples of what dissemination can look like. So some examples can include being an expert on your research, where you get interviewed by traditional media. And again, this, there's a million different ways you can get your outreach or your information out there. Today, I'm going to be focusing more on the communication-based effort. So that's what we're looking at here. You can have social media posts about your work. That can be posts that you create and put out on your own personal channels, or it can be information that you share within your organization so they can put it out on their social media channels, and we can talk about what that looks like. It can be fact sheets, videos, toolkits, blog posts, infographics, and I want to make it really clear so that you don't get overwhelmed. You can do all of this yourself with help, or you can work within your organization with the resources that are already there to feed them the information so that they can create these materials and get it out for you. It depends on where you are, what your comfort level is, and what your goals are. So when we're talking about this, all of these things, that I'm not necessarily saying you have to do this yourself. I'm saying you can figure out who it is at your institution can help you do these things if you don't have the skills, time, or resources to do it yourself. Some of the newer type things are what I call shareables. So the visual abstract is a great example. This is one that I put here that we created based on one of our studies on ATV injuries. And so it is a visual summary of what the research found. And this has been used in presentations, in reports to government organizations, funders, to our own institution, and on social media and presentations. You can use it lots of different ways. Top right is social videos that we have created. So I don't have the actual video here, but it is a video that is a short 30 seconds or less video that is a summary of this particular research project. And it is meant to be shared on social media platforms like Twitter, Instagram, TikTok, etc. You can see this one has the text on it. So, because we know a lot of people don't actually watch videos on social media with the sound on. So we're making sure we're accessible and that they're actually learning from it. This down here is a GIF that was created, same thing, shared on social media. Very simple, but it is information about how people can prevent injuries on ATVs that got shared on a variety of different platforms. And even just a simple little GIF to draw attention to some messaging we had about sun safety. So there's lots of different ways and things you can do with your research that help draw attention and get the word out there. And it also can increase outreach to diverse media outlets when they see the different types of things that you are providing. So this is another example. I'm going to hit play here in a second. And a lot of times, or not a lot, but some of the time when you submit research articles to journals, they will ask you to do a video. And I know a lot of our researchers initially were saying, oh, I don't know how to do that. It's not a skill set I have. We're not going to do that. But as I started to connect them with resources at our institution who could help them do the filming. Now it becomes much easier, and it's a great way to show the journal that you're willing to put in extra time and help promote. They'll put it on their social media platforms, on their websites, and it gets your work more views. And there's research that shows that. So your research spreads more widely when you have additional materials to help support even within the journal, and your own institution and yourself can share as well. So I don't have the full video, but I just wanted to give a little clip of what one example of a video from our institution looks like. There is not sound at the beginning. It comes in just a few seconds in.
Hi, I'm Dr. Leah Middleberg, a pediatric emergency medicine physician at Nationwide Children's Hospital. Welcome to the video abstract of our new publication in pediatrics titled Warning Labels in High-Powered Magnet Exposures. High-powered magnet products are made of rare earth metals, usually neodymium. That is up to 30 times more powerful than the average refrigerator magnet. They are among the most dangerous childhood foreign body exposures in children due to the strength with which they attract to each other across human tissue.
So these videos can be a little bit longer, and they go into more detail when they're for the journals. And I think this one was 3 minutes or so total. And she goes on to talk about how they did the research, what methodology they used, and what the findings were. And it's a great way to get your information out there in another format. We also do educational videos on YouTube. We have a YouTube channel that we've created videos, and these can be really simple. You can have video if that is something you can do. I will say with the phone technology now, it is very easy to even shoot video from your iPhone that you can share on videos like this, and you can create voiceovers using iMovie or things like that to make it really simple. So there are, you can use some of these videos on our YouTube channel. We even just used still shots of photos that we found through stock photo sites or that we took ourselves and created voiceover videos like that. So there are some simple things that you can do to help get your messaging out there that way. This is another video we created based on one of our research studies. This was created using a program called Vyond, which is pretty easy to use. That's VYOND. You can also create videos in Canva and other platforms now that make it really pretty simple. But this is a great way to get attention. So in this one, our audience was the public. So we weren't talking specifically about the findings from our research so much, but what parents could do to help protect their children when they were on home exercise equipment and they have them at home. So things that you can do that way to get your information out based on your audience. So I know not a lot of researchers are on TikTok yet, but our hospital has really started to embrace TikTok, and they are doing a lot of videos. And it's a great way. So we do child injury prevention. And at our center, we don't have a TikTok channel, and our communications are heavily focused towards researchers. But we work with our hospital's media team to get information out to the public, and they have much bigger reach, and they can get to parents directly and do things that we can't necessarily do. So when you're thinking about getting your information out there, think about who your partners can be, what your institution might have that they have access to, and things like TikTok. How you get the messaging out, you have to pay attention to what the trends are and how people put information out there and what that looks like. And our researchers don't have time to stay on top of all of that, but what we can do is say, hey, we know car seat safety is important. We can help you put together the messaging for the video if you help us create it and help us use a trend, some of the trends. So I'm going to play this video. It's short. It was TikTok, and it shows this is a trend that was happening on TikTok, where they use voiceover from another pop culture reference. Sometimes it's music, sometimes it's something that happened on a popular TV show, something like that, and you use the voiceover from that to share messaging. So this is an example of those that was on car seat safety.
How I feel about certain design choices with little to no explanation. Yes. Yes. Absolutely not. For me, this one's 50-50. 100% no. Yes, and I don't care that it's impractical. I hate these. I think I might hate this even more. Yes, of course. No.
So that's a great example of getting information out there, getting information to young parents who are on TikTok and in places where many researchers aren't, but getting important information out there. And as I mentioned, if you, as a researcher, you're not on TikTok or you're not familiar with those trends, you're going to communication experts who are familiar with those to help you reach that space. We also can do things around equity with visuals and getting our information out there that we can't when we're just reporting our science at, in the journals or at conferences, right? So this is, these are some visuals that we created based on a study that we did on stair-related injuries among children. And we looked at all different things, but we made sure when we created our visuals that we addressed a variety of different people who might need to hear the message. So we had families with two moms, we had Spanish speaking families, and we had it in Spanish. So we were really thoughtful about the kind of messaging that we were getting out there. These are images which we were really fortunate to find an intern. I was talking at a health communication or an injury prevention class at University of Pennsylvania, and was talking about the type of work I do. And we found an MPH student who happened to be an artist and ended up coming to work with us for the summer. And she hand drew and created these graphics that that are hard to find sometimes. Sometimes when you're looking for health communication information, it's hard to find visuals that aren't all white families in wealthy situations. So increasing, how we're talking about things and what materials are available are, some great options we have when we're talking about expanding our health communications efforts. Wanted to also share this. So this was a poster that came about with a collaboration we had with an organization called Black Girls Do Bike. We were trying to increase young kids and teens using bicycle helmets when they're riding bikes. And one of the things we kept hearing is, I'm open to wearing a helmet, but I don't know how to fit it with my natural hairstyle. And so we worked with Black Girls Do Bike and had lots of conversations and ended up developing this poster because nobody had anything like that. We tried to find resources out there and there wasn't one, there wasn't anything that we could point people to. So we were able to create this poster, and it's now being shared with their over 200 coalitions across the United States, and other people are picking it up as well. So that information is getting out there. Another thing that we do is we do like to go to traditional media to get our story out there. And there's lots of different ways you can do it. This is an advanced example, and we're going to go into a little bit more detail with a case study, but we actually try and make it as easy as possible for the media to cover our stories. And we create newsrooms that have a bunch of different features in them. And like I said, we're going to talk about that in a case study. We didn't start doing this, and we don't create this ourselves. We work with a partner who we pay to create these newsrooms for us. So that is an option, but it is something you have to think about ahead of time, plan for, put in the budget if you're going to do that. But the impact can be huge if you are able to do that. Also wanted to just show some examples of what research can look like. Most of the social media examples I'm going to show are based on Twitter because that's what we have primarily used. LinkedIn is another place where people are really starting to put research on social media, and we are seeing it on other platforms, like I mentioned, TikTok, Instagram, things like that. So it is out there, and you can take most of these examples and use them in different ways across the different platforms. So this is an example of just linking to your journal article and tagging the journal in it and any organizations that where you present. You can also post about trainings or educational opportunities that you're doing and help get your word out there. You can even post about grant and funding opportunities, either from funding organizations or from yourself. You can find information about that on these platforms. You can recruit. This is on the left here, is we actually are recruiting for some of our products via social media, and I'm finding some success doing that as well. And then this, I just wanted to show, is another example of something that we've started to do a few years ago with some of our research. We actually are pulling some of the quotes from either press releases that we do, or if we're not promoting the research through traditional media, we will get a quote from our lead researcher and put a visual to our social media, because there's lots of research that shows if you have a visual, it will draw more attention. So it's a really simple thing you can do, stock photo with a quote overlaid, and now you have some more information, and you can drive people to the paper if they want to see more. We also have researchers doing things like this, Dr. McKenzie, she was quoted, did a interview for the New York Times, and then she has her own personal Twitter handle, and she retweeted what they posted, and it keeps the New York Times coming back to us as experts and helps get the word out to an even broader audience. So you can do things like that. And then we even share work that we're doing on advocacy through social media and things like this. Here we shared part of a document that we created teaching people how to strengthen local firearm safety laws. So there's all sorts of ways you can do it. This next one just shows some examples of how people are sharing their research on LinkedIn. This is really a space that is taking off. I definitely recommend looking into LinkedIn if you haven't done that yet. Lots of people are moving over there as Twitter is becoming a little less friendly. And I mentioned advocacy, but there, just wanted to mention there are a lot of reporters and policymakers that are still on Twitter. And this can be a platform you want to use if you're trying to reach those groups. This is an example here of thanking a policymaker for the work they did and being involved in an initiative. You can do lots of work that way. Here's an example of your own Emmy Betts, who is showing that she's out there doing the work and talking about how people can make a difference, and thanking others for being involved in the efforts as well. Great way to get the word out there and acknowledge people who are doing the advocacy work. Okay, so I wanted to do a quick little research dissemination case study now that you've seen some examples. This is what we did for a series of studies. So for this example, we're going to talk about laundry packets. So when we started this process, it was back in 2013-14 when we started the research. There was this new product on the market that came out in 2012, and people were not aware of the potential dangers of this product. And we started hearing from our Poison Control Center, whoa, something's happening. We're getting all these calls about this new product, these laundry packets or pods. And we wanted to do some research to see what was happening, how big of a problem it was, and what we needed to do to get the word out about it, and in a big way. So our first research study found that between 2012 and 2013, there were more than 17,000 calls for kids under 6. 769 were hospitalized, and 1 even died. And so this was a big deal. And we knew people, because it was a new product, didn't know that this was happening and what was going on. So the first thing we did is we tried to identify who is it that we need to reach with this message, and what do we want them to know. So we identified our audiences as parents, industry, and policymakers. So for parents and caregivers, we wanted to educate them about the dangers of these products. And for industry and policymakers, we wanted to put some pressure on them on finding ways to make packets safer. So when they first came out, they were in these clear containers that look like candy dishes with really brightly fun colored things. And the child resistant packaging was somewhat non-existent, or at least ineffective. So we wanted to have them do more to address that. So what did we do? We designed some different messages for these different audiences. So for parents and caregivers, we put out the message, if you have young children in your home, use traditional laundry detergent instead of laundry detergent packets. We also, because we're at a hospital, had some messaging for healthcare providers, asking them specifically, tell parents and caregivers about the dangers of laundry packets and the need for careful use. For industry, we called out specifically, we want you to adopt child-resistant and opaque packaging to make it more difficult for children to access these products. And for policymakers, we said we need a national safety standard to make sure all laundry packet makers adopt safer packaging and labeling. So we had specific goals in mind. What you can see here is we actually set up a scenario where we invited families in and brought their children in, and we had these products available to make sure that the kids were safe. We did not use actual laundry detergent packets. We made fake ones filled with things like certs and colored gels and things like that. So the kids were not put at risk. We also had some visuals created. So you can see here in the top right, one of the problems with laundry detergent packets is with laundry detergent, if kids get it, they get a little bit amount and it's liquid in their mouth, right? But with laundry detergent packets, it's a bite-sized explosion of chemicals that are more concentrated than laundry detergent because they need it to be, because it's in a smaller package. And the casing is designed to melt on water or saliva, so it can be really dangerous. So we wanted to talk to people about how big of a problem this was. So we gave them the numbers, which was 17,000, more than 17,000 over the 2-year study period, which equaled a child every hour. We made it understandable to them. 17,000 over 2 years, hard to understand. A child every hour, that helps put it in place how often this was happening. And then we had some visual demonstrations that I talked about. We compared laundry packet packaging to food products. We showed some video of how easy it was for children to get into the child-resistant packaging, and got some testimonials. So we also added a personal story. We had a mom with us who talked about her surprise at how quickly the kids were attracted to the packets, how they confuse them with food, and how easy it is to open the packaging. So you can see here, here's a laundry detergent packet product, and here's Reese's. And if you can't read and you're a child and you're used to being allowed to get into this packaging, you can see why it would be confusing that you can't get into this. Even though it has warnings on here, if you can't read and you're a young child, you're not going to know what that is. We all were also surprised at this example. Marshmallow laundry detergent packet. We had a packet of laundry detergent packets, and one kid ran over and picked it up and said marshmallow, even though we as adults think it looks nothing alike. The children don't know any different, and we're able to show that. We also made sure that we had really clear calls to action. So we gave the recommendation, do not use these products if you have young children that live in or visit your home, and keep laundry detergent of all types locked up high and out of reach. We also had clear industry calls to action, calling for voluntary safety standards and product and packaging redesign. As you can see, we were successful. They moved from this clear packaging to more opaque packaging, which was one step in the right direction. I mentioned earlier, we also had a newsroom, and I want to point out some of the features that we had in our newsroom. So this in the top left here was a video that I mentioned that had some of the, you can see here the kids and some of the things that we did, and that's where the parent testimonial is and things like that. We put that together. We also had visuals of our experts and the information and bios there, so the media can download that without even needing to ask us. We created social media posts that we could make it really simple. Share this on Twitter, and here's the link to the story, and have that right there if they want it. And then we had a short little blurb, smaller than the press release, that could be copy and pasted for an online newsroom, or if you wanted to put it in a newsletter. Nice and simple, easy wording. We also had extras. So you can see here, we have a press release, we have a TV script, we have these different ways they can download it. So B-roll is that thing where that's the kids playing in the background and the anchor is talking over it, talking about the story. That B-roll is that background. We have just bites, which are just quotes from our experts. The full news package, just audio. If you're doing a podcast, we provide it in lots of different ways. We also provide images along with a description of how you can talk about what those images are. So we create all of those materials and make them available to news sources if they want to use them. So we're trying to make it as easy as possible. This company even goes so far as to create a script for us. We did not write this ourselves. We had our partner do this, and then we just edit as needed. But you can see it has things like we can make it so easy for them. It even has the suggested teases. So these are the things that you hear when you're watching the news. So the first one says, they're convenient and increasingly popular, but research shows how dangerous laundry detergent pods are becoming to young children. Coming up, hear what's now being done to protect kids. So you can imagine an anchor saying that and teasing it and then actually going into the story. So we create the whole story for them. We have social media posts. We have quotes from our experts. Here's a quote from our mom who was there. We make it really, really easy. And then extras if they want to create their own. So super easy. And again, we worked with a partner for this. So that can be really helpful. So we had some success, and the word got out there and there was buzz around it. And then the industry started fighting back a little bit, saying, no, this isn't happening as much. There's so many that are being sold. There, if you look at how many are being sold versus the number of injuries, it's not that bad. And then we started hearing from legislators saying, hey, we think we can do something about this, but we need you to get back out there. When you put the story in the media, our constituents talk to us. Now the industry is fighting back. We need you to do it again so we can put some pressure on them to address this issue. So we did a second study, did another video, did an infographic and some more materials, and got the information back out. This one, we also created some social media graphics and did a Twitter chat. Now, this was back in 2016, but you can see with our Twitter chat, which is 1 hour, but we tracked over a 24-hour period. We had 216 different contributors with over 820 tweets reaching with timeline deliveries of more than 2.8 million in just 24 hours. So we were able to get the information out there and shared, and it was shared with Parents Magazine and other groups like that. So we were able to get the word out there. And this outreach had impact. So the first story, we had more than 1 billion with a B, audience impressions. The second one, we had more than 1.8 billion audience impressions. We were hearing stories of behavior change all over the place about families telling us we didn't know this was a risk. We're either not using them anymore, or we're making sure that we're storing them up and away and lock cabinet if we are using them. We had industry response. So industry started creating informational videos. They added warning language to videos, and they started some redesign of the child resistant packaging and how they were designing the materials. And we started to get some of the voluntary standards that we were requesting, not all that we wanted. So there were some concessions we had to make, but we did see movement. And so this really worked, not only as an educational tool, but to get standards changed and to cause companies to redesign their products. So we saw that as a big success. Okay, so now that you've seen those examples and you've had that case study, what do you need to do to get started? So I want to start with talking about acknowledging that for many researchers, this is what they think about dissemination. It's not comfortable. It's not something we're taught how to do. We're taught about how to publish in journals and maybe present at conferences, but we aren't taught about how to get the information out to the people that our research affects. We have to learn about where they are, and we have to change the way we talk for them to be able to trust us and understand how our research is relevant to them. This next picture is an actual photo of a researcher when I told them that I wanted them to do a media interview and media campaign. Seriously though, a lot of people really don't know and aren't comfortable. So if that's you, what can you do? So start where you are. Remember, you don't have to do this alone. If you're there in Colorado in the Injury Center, you can work with Noelle, and she can help connect you with internal team and partners to help get the word out. But remember, you don't have to do it all on your own. You can find partners that will do it for you. Some of you will want to just jump right in and do it. And others, if you aren't comfortable with that, that is okay. Just dip your toe in and get started. Okay, so what are some of the things you need to know? So remember when you're talking that your goal is not only to report the findings, but to connect the dots for the readers. You need to guide them in how to understand the findings in a way that will lead to the info having an impact on them and leading to change. Many researchers I talk to, they assume that just sharing the data will lead to people understanding what the science is telling them and how it impacts them. But that isn't the case for most people. Most people don't know how to look at our science and understand and translate what it means to them. So we have to help them understand, take them through connecting the dots and showing the insights and leading what the wisdom is, and then it will have an impact. And for many people, nothing happens until somebody feels something. There's a Andy Goodman quote that says, "Nobody ever marches on Washington because of a pie chart." We have to tell them why our research matters and what impact it has on them. So if you want to start really getting your information out there and really having an impact, what are the things you can do? First, you need to start planning for dissemination from the beginning. We're going to talk about that. You need to find out who at your organization has these skills or jobs and introduce yourself. As I mentioned, for those of you at IVPC, you can start with Noelle. If you're not with that group, there are people at Colorado or other institutions who will do this work for you. Or in partnership with you if you just find out who they are. And then start thinking about what types of dissemination are possible and fit with your communication goals, and then get training. I'm not going to talk a lot about that here, but there are lots of places that you can go for training. Our Center for Injury Research, Translation, and Communication, or CIRTC, CIRTC, has some training. We're going to work with Colorado to provide some of that. But there's lots of great places out there, and many institutions have media training. If you want to work with traditional media, you can get training from your own institution a lot of times. So when you're thinking about building dissemination from the beginning, how do you do that? First, you want to start by writing money for dissemination into your grant budget at the beginning. If you wait to think about this until you get the grant and later, there will never be enough money left in the budget to do what you want to do, or you're going to be limited in what your dissemination options are because you don't have enough money in the budget for larger efforts. So do it from the very beginning and start to think about what that looks like. You want to identify audiences that will be impacted by the research and think about where are they? What types of things will they need to know about your work for them to be able to do something about it? So thinking about that ahead of time helps make sure the dissemination is the best that it can be. And you also want to start to think about what resource materials you will need to create, because it takes a lot longer to create some of these than you think it will. And it takes money to create some of them. So thinking about all of that ahead of time will help you be able to do some of the things that I showed, because videos and things like that, you got to think about that in advance. You can't say, this is coming out next week, and have a high quality video ready to go. You need to have some of that work done ahead of time. So what types of communications opportunities are available at your institution? Knowing who to get the content to is a huge first step. this is just to get you thinking. It's a little bit different for every organization, but these are the types of things that some organizations have. You will have things like external communications. This is, your group who talks to media on social media, PR, to corporate entities, your community, your website, your education, all of that. You have internal communications. For us, we're at a hospital with over 14,000 employees, many of whom are parents themselves, and we do child injury prevention. So it's important for us to get it out internally as well. So we get our information in company newsletters, on our website, on-site digital platforms, things like that. Government relations is good to know because they can help you figure out if advocacy is a part of what you're going to be doing, who to talk to, when to talk to them, how to talk to them, what that looks like, and who your creatives are. Who do you have internally who can help you with photos, videos, graphic design? We've had interns who have been able to help us. So we even had one of our admins who had a photography business on the side that we didn't know about initially, who was able to help do some photography for us. So you never know who's out there. Start asking questions. You also need to figure out how they work. Each organization is a little bit different, and you need to learn how yours works. Starting with things like how often and when do they meet? Our team has a monthly media with someone from our media team, and she takes the information on any of our research that we'll be covering in the media to the other teams. However, if we're not going to do a media push, then we go to the other parties directly. Just got to figure out what that looks like. And then you need to figure out, do they work together, or do you have to get the information to each team separately? Every organization is different. You got to figure out what that looks like. And importantly, what are their deadlines? For some of the materials we have, the deadlines are 2 months in advance. So what does that look like? Can I do that? How do I do that? How do I get information out there? And you don't have to have a paper that is fully published. In some cases, some of the recommendations aren't going to change. So if it's a parent facing, you can say, okay, I don't want you to publish this for 2 months or until it's published, but let's get started working on it, and I'll let you know when it's okay. And you can talk to them about embargoes and things like that. Again, if you're in the injury center there, Nicole can help you manage all of these processes and who to connect with and what that looks like. You do want to listen to their expertise. You are the experts on research and injury prevention. They are the experts on health communication and health communication. So listen to their guidance. So the earlier you can get them the information, the better it is, and the better they can work with you to help decide a package and what it looks like. Listen if they say, maybe media coverage is not right in this case, but what can we do instead? Listen to that, because it's not all, every research isn't for the general public. So what does that look like, and what can you put together? So be open to hearing their suggestions and approach, and even potential hooks. In order to get the media to cover something, they have to have a media hook. It may not be what we as the researcher wants, but if it gets people to listen to the story, as long as it's accurate, we don't want it to be, misleading. But if it's a way in, and then we can get them to listen to our research, that's okay. But it is also important for you to know you do have veto power. If they are trying to lead you in a direction that you aren't comfortable with, it is okay for you to say, nope, I'm not comfortable with that. That's not how I would talk about it. Let's look at it this way. I did also want to put a note on here. There are times when our own institution has said, I don't think that's media friendly or worthy. I don't think the media is going to pick that up. But we had some insider information about why it mattered. A great example is the second laundry packets. They said, look, we already did laundry packets. We did a big study. It got over 1 billion impressions. The media is not going to want to do that again. And we said, yep, I think they will. Here's why. We have new findings, and our legislators are telling us that we need to do this and that they will help promote it. And we had even bigger coverage the second time. So we pushed back a little bit. So you can do that. I know I keep saying this, but timing matters. The earlier you can get information and start thinking about how you're communicate it to your larger audience, the more time you have to come up with more options, more creative options, and put more into it. So we have our researchers now tell us when they start doing research, we're going to start a paper on whatever it is. And I start thinking about how could we promote that if this paper gets accepted? We start really early with that. So start early with your communications people. Learn their cycles, and then be creative in thinking about how can you tie into things. Maybe there's an event or a time of year or an awareness week or month that's coming up that might make sense for them to talk about either new research or research that you've already put out there, but now's a good time to talk about it again. There's always ways you can get that information out there. You also want to show your commitment to them. So you can do things like getting media training, learning about social media, learning how to talk about your research, making sure you're available. If you're going to go out into the media, you have to be available to do interviews and know what that looks like. And for the media, sometimes their timelines are, if they contact you at 10 in the morning, they need you to respond to them by 1 so they can do the story and have it on the evening news. Their time cycles are really fast like that sometimes. So you need to know that if you're going to start going out there, what that looks like. And for your own institution, always make sure to state your organization's name so that you can help promote your organization as well, so they will continue to support you. And then make their job easy. The easier we can make it for people, the better it is. So you can think about, is something the first time something's happened, or the best, or the only, or the new? All of those words media like to hear, media, social media, that all gets picked up. You can think about assets that you can provide. Do you have patient stories or parent stories? Do you have data that could be exciting? Do you have visuals that you can share, or ideas for B-roll? Any of that stuff can help, and you can share that with them. And then acknowledge that marketing and communications trained people are not trained in epidemiology research methods always. Usually they are not going to be able to fully understand how to interpret what you can and can't say about a certain research study based on the methods, based on the data set, things like that. So you do need to make sure that you really are looking at what's getting put out to make sure that it can actually be said in the way that it's being shared with the communicators. And it is okay that they don't understand that. They have their skill set, you have yours. Together you can get the information out there. Okay, and last piece here, just kind of ending with this, is a reminder that you use peer-reviewed articles and talks at conferences to report your science. You use media, both traditional and social media, to help people understand what they can do with your research. So that's a little bit of the distinction. Okay, for the last few minutes, I'm going to talk about AI because it's so big right now and everybody's talking about it. There is a lot to learn about AI before you use it, including whether or not it is allowed at your organization. So definitely check that if you're going to use any AI. It is not allowed at our institution without prior approval. So definitely check into that. It is important to understand how the AI programs work, what they can and can't do. There's ethical questions around these platforms and concerns about potential bias in the output. I have a whole nother presentation I give just on AI. If you're going to use it, I strongly recommend you look into some of that before you just jump in. However, that said, I do believe that there are some really interesting uses for AI around dissemination and outreach, and I'm going to share a couple of those here. So one idea you can use it for, and these examples are mostly using ChatGPT because that's what most people have heard of. There are many other options of AI programs out there that can do everything from text creation to video and audio, and even AI programs that can help you with your lit reviews. So if you haven't jumped into that space, I definitely recommend that you do it. These examples I'm going to show right now are based on a paper that we published in 2008 on golf cart related injuries. I just wanted to see what I could do with a paper that's already been published. So for ChatGPT, you can't put a whole paper in right now, but you can put parts of a paper. So I copy and pasted the discussion section of this research paper into ChatGPT after I wrote the prompt, what are the main points of this article? and it spit out a paragraph for me that wasn't too bad. So it was a nice summary paragraph to talk about what the main points of the article were. I also said to it, explain the findings to me like I was 10. So this is where we can start to address some health literacy issues. But also, if you're going to go out into the media for the general public, you have to stop talking like a researcher and scientist and start talking in ways that are more friendly to a wider audience. And it actually did a fairly decent job. I would never use anything created by these programs word for word and exactly how it spits it out, but it gives a good idea of where you can start. I also asked it to create 5 Twitter posts based off of the study, and it did a pretty decent job with that, even including some hashtags. One warning is at least ChatGPT right now, the data that it was used to train on stopped in 2021. So things like hashtags are going to be old. So you should definitely double check all of the stuff that comes out. But it can be a good place to start for ideas. I even had it do things like write a script for a doctor to talk to the parent of a young child about the findings from the study. And it went through and gave a script of what might happen and how a conversation might happen that a doctor can share with a parent. And I had it write a letter to a golf cart manufacturer asking them to improve their golf cart design based on the findings from the research. And it did a pretty decent job. So there are some really cool things you can do with it. You can also use it to do things like help organize training. So I got asked to do a training on ChatGPT and public health. And out of curiosity, I put some prompts in and did things like create catchy titles for a talk, write a description for a webinar, write learning objectives, create an outline for a 45-minute talk. It can do all of those things for you. I did not use any of those exactly as they were, but it was a place to give me ideas. You can also use it for grant writing by doing things like rewriting and shortening or summarizing text, editing for clarity and readability, creating charts, graphs, visual aids, identifying potential partners, tailoring to grant requirements and specific funder styles. But please, please, please be aware of this. Do not put any confidential information, PHI, or anything proprietary into AI programs. When you use those programs, they are using your information to train, and it gets brought into the programs and become a part of the program. So if you have a brand new grant idea that is really innovative and you put it into these programs to do some of these things, your idea might be out in the public before you get funded. So be really cautious about what you're using them for and what you're putting in there. And just kind of to end, you can use AI programs to help create structure for content while you create what goes into the structure. I like to think of AI as like an intern. It can get you 70% of the way there, but you need to do the work to bring your voice and your expertise to get it right. And always assume that the data is wrong and fact check everything. We're going to end with some opportunities for training. I mentioned CERTSI. There are some examples of trainings that we have, and we even have a media and social media for public health certificate that you can earn. We are working on potentially partnering with your group to offer some of these trainings, and Noelle will share more information as we hammer that out. And I wanted to thank you. I know I talked long, so we only have a few minutes for questions, but I am very open. If you have any information, reach out to me after the session, or if you have questions now, you can type them in the chat and we can answer from there.
Great. Thank you, Tracy. That was a wonderful presentation. Very, very helpful. So if anybody has any questions, please feel free to unmute yourselves, or you can use the chat. I do have a few questions while you guys think of other questions. Let's see, when it comes to sharing with your internal team, have you found any methods or tools that you have found to be the most effective with promoting collaboration between you and the researchers and the knowledge exchange?
So that totally depends on your team and what it looks like. We actually use Slack, which is an information channel that we use that has been helpful, but it's going to depend on and what your team puts together. I mentioned we have a standing Zoom meeting with one of our media team just to kind of check in and say, hey, this is what we're working on. This is what we have coming up. How can we help you? What should we be aware of initiatives that are coming up? So unfortunately, I'm going to give the epidemiology answer of it depends. But find something that works for you and your organization.
Okay. We had somebody ask to go back to the media tip slide.
Oh, okay. Let me share my screen again. Give me a sec. Okay. Media tips slide. Not sure exactly which one. So not AI. Specifically, which one? Maybe getting started.
This one.
Oh, this one.
Hi, it's you passed by it, but now I don't know which direction it is.
Okay.
I think it was after this one, maybe.
Oh, I bet this one.
Yes, this one. I thought that was so helpful to see, and I just wanted to look at that again. Thank you so much.
Absolutely. And Noelle has a PDF of this presentation as well that Noelle, you are welcome to share.
Okay, I will do that. And we'll also have this recording up on our YouTube channel. So we'll have that as well. Are there any other questions? Okay, great. Well, thank you again, Tracy. This was very, very helpful. Again, you have done great work in this field, and I think this is a great start to get everybody generated with some ideas. So hopefully everybody's leaving with some new ideas. I know I definitely have, so thank you.
Thank you. And I just touched the surface on many of these. So you can go way more in depth than any of these. If anybody has questions, reach out to Noelle or me and we can figure out how to get more training or more information. Thank you.
Thank you.